Hi, everyone. I'm Heidi Murkoff, and I am so excited to welcome to our What to Expect family yet another public health hero. She was appointed director of the CDC back in January, right in the middle of a pandemic, and she took the job anyway. So props to her. She has over 2 decades of impressive public health credentials, but I have to add, she's also a mom of 3 sons. And I am not sure what prepares a person better for handling a crisis calmly and compassionately than that does. So Dr. Rochelle Walensky, thank you so much for stopping by.
Thank you so much for having me, Heidi. I'm delighted to be here.
Oh, so you say, and I totally agree, that we have to meet people where they are. And I got to tell you that where moms are now is worried. You know, they're worried about getting COVID. They're worried about getting vaccinated. They're worried about their kids getting vaccinated. They're worried about everything. And if there's one thing that pregnant women do well, it's worry, right? I always start with a premise. I think it's helpful, and I think you probably do too, that every parent wants the best for her baby. Every parent wants to keep her baby healthy and safe. That's her priority. And I think, I'm sure you felt the same way. All of us have, you know, when we're pregnant or about to become pregnant or breastfeeding, you worry obsessively about every substance that is going into your body. And so I don't think it's surprising that pregnant women and new moms are resisting, maybe hesitating about the vaccine more than others are. You know, they're thinking twice. They're thinking once for their babies and once for themselves. So what I'd like to do today is just present the vax facts, right? And dispel some of the disinformation that's out there. Why are experts so convinced, including you, that the COVID-19 vaccine is safe for pregnant women?
So we have numerous studies here, and this is really important because I do know you want to control everything. You want it to all be perfect, and you worry, right? Because there are so many things that feel like that they're not in your control. Mm-hmm. The first thing I think that's really important to understand is that pregnant women tend to have more severe disease than non-pregnant women. So it's really important to make sure that they're protected, because if you want to do anything, it's to make sure that you are delivering a healthy baby and you are there to be the mom to that baby for a very long period of time. And so we really do want to make sure that those pregnant women are protected. We now have data on pregnant women, not just getting vaccine in the 3rd trimester and the 2nd trimester, but now even the 1st trimester. We have that period of time. Early on, we could say in that 3rd trimester, no outcomes that were different among women who were vaccinated and women who weren't vaccinated for their babies. And now with more and more data, we're seeing that there are really no differences in outcomes in terms of fertility, desire to get pregnant, adverse baby outcomes, really, if you've been vaccinated or not. So what we really know now with a wealth of data and numerous studies, thousands of pregnant women, that you are at higher risk if you don't get vaccinated, and that outcomes are the same for mom and baby if you do get vaccinated.
Okay, that's really reassuring. And just, you know, the risks are, can you just explain what they are? Why are pregnant women, we know they're more vulnerable when it comes to flu season, but why are they even more vulnerable when it comes to COVID, and how much so?
So pregnancy does place you in a higher risk category. Certainly there are other risks, diabetes, obesity, older age. There are certainly other risks, but pregnancy happens to be one of them. We have seen pregnant women more frequently going into the intensive care unit, more frequently requiring mechanical ventilation, and more frequently passing from COVID-19. And gosh, if there's nothing tragic about being so sick, it's being so sick and having a baby that really needs their mom to take care of them. And so that's really what we're trying to do here, is to communicate that the vaccine prevents that. What we really do know is these vaccines are safe and effective. They're safe and effective in the general population. They don't change your rates of fertility. And in fact, they're safe and protective against COVID-19 among pregnant women.
Oh, that's great to know. And also, if you're going to put on your mom hat and go back in time and say you were pregnant, Would you get the vaccine right now?
Absolutely.
Okay.
Absolutely. Because I mean, and I'm pregnant 3 times. Yes, I absolutely would, because I know that there's a lot of disease out there right now. And there are a lot of women who are worried and are not getting pregnant because of the perceived risk that they have. But what I really want to communicate to them is that the perceived risk of the vaccine is so much lower than the risk of the disease itself. Absolutely. And so that's really critical for women to understand.
You are preaching to the choir, but we're preaching to a bigger choir right now. We need everybody to listen up. Are the symptoms of COVID-19 the same for pregnant women as for other women? One thing that worried me early on in the pandemic is that so many late pregnancy symptoms are kind of similar to symptoms of COVID. And I was concerned, well, especially when testing wasn't widespread. How do you tell the difference? You've got the fatigue, you've got maybe a cough because, all the postnasal drip. And that too. and you're finding it harder to breathe. Is that something you've run across?
Yeah, the symptoms, the one of the big challenges with COVID-19 is so many of the symptoms are non-specific, right?
Yeah.
And so one of the symptoms that's often the telltale is losing your sense of smell or taste. That one's pretty, it doesn't happen often, but when it happens, you can really tell that it's COVID, and that does happen. The cough, the shortness of breath, the fevers, the runny nose. So they do sort of appear like symptoms of just a regular upper respiratory syndrome. Yes. And what I would say is get yourself tested and really make sure that you don't have COVID-19 if you're having those symptoms.
When in doubt, check it out.
Absolutely.
One thing pregnant women never lose is their sense of smelling. In fact, it is heightened to a really uncomfortable degree. I'm sure you
Indeed.
If you happen to test positive for COVID-19 while you're pregnant, and I'm getting a lot of messages from moms who have, what do you do? Is it something where you call your OB? Or do you wait and see? Do you go straight to the hospital? What's the best plan?
Right. So I think part of the question there is, why did you test? If you tested because you were exposed and you really are not having any symptoms, you might want to check in with your OB, but there may not be really necessarily anything to do. However, if you're starting to have symptoms and you're starting to have some mild to moderate disease, you absolutely should check in with your OB, because in fact, you may be a really good candidate for monoclonal antibodies. And so you do want to check in earlier to make sure that there's no stone left unturned in terms of what treatments would be available to you.
And monoclonal antibodies, which are being recommended as for pregnancy in some cases, they are safe for pregnant women to take?
They absolutely are. And if you happen to get infected while you're pregnant, it is one of the indications for monoclonal antibodies is to be pregnant with COVID. They are safe. And what's really important about them is they help to prevent more severe disease if you get them early. So you don't want to sort of say, should I go to the hospital? I feel really sick, or should I get monoclonal antibodies? The time to think about monoclonal antibodies is really early as you're starting to develop symptoms.
So it's about within 10 days or so?
Yeah, even earlier if you can. 3 to 5 would be great.
Okay. So let's talk about breastfeeding. At the beginning, nobody was sure, like, should you breastfeed? Should you not breastfeed? Then it became clear that even if you had COVID, you should breastfeed with the proper precautions. Is it safe to get vaccinated while you're breastfeeding?
It absolutely is safe to get vaccinated. So I would say if you are thinking about getting vaccinated, there is no bad time to get vaccinated. Get vaccinated while you're thinking about having a baby, before you're thinking about having a baby, while you're pregnant with your baby, or after you've delivered your baby. There is no bad time to get vaccinated.
Except maybe when you're trying to make a baby in that very moment.
Well, yeah, maybe not.
That might be awkward. Might spoil the mood just a little bit. So it doesn't decrease your milk supply, anything like that.
There have been some anecdotal experiences that it may temporarily, just in that day or two, decrease your milk supply, but it does not do anything for the long term of your milk supply. We don't have a lot of data in this area, but we have not seen that interrupt milk supply over a long period of time.
Awesome. And stay hydrated, obviously.
Absolutely.
How much do we know about the antibodies that a baby might receive if the baby's mom had COVID or is vaccinated? And is there a difference between while pregnant and also while breastfeeding?
So we don't have a lot of data on what we do know is that those antibodies do transfer while you're pregnant and while you're breastfeeding. What we don't have a lot of data on is how long and how well they protect the baby. And so those data are still, we know, so we would like to think, and science might suggest, that if you have antibody protection that's transferred, that baby might well be protected. I wouldn't necessarily rely on that protection for baby. And because the studies are still ongoing as to how well and how long that protection lasts.
And that's an important point, I think, because when we hear antibodies, we think, oh, well, baby's, safe.
It's fine.
Baby's fine. No worries. Let's just go out in a crowded space, have a party, whatever. No. And that's why I feel it's important to babies in so many ways need to be cocooned, especially newborns. And that's, for me, probably the best way to do that is to keep baby away from other people, but, not take the risks. And also masks. Anybody?
Yeah. And so what I would say with that is the best way we can protect our really vulnerable children who don't have a capacity right at this moment to get vaccinated themselves is to cocoon them, as you said, around people who are vaccinated themselves. Right. So the less opportunity they have to potentially get disease because they're surrounded by vaccinated people, the better they will be. And then, of course, as you note, to mask, right? Even among people who are vaccinated, I don't know, my newborn, as you said, you're cautious, you want control, you want to be so protective, have people mask when they're around your newborn baby.
Yeah. Okay, I'll let you share this with all the grandparents out there. See how that goes over. But no, I totally agree. Cases in children who can't be vaccinated, especially those going back to school or daycare, are soaring or going up enough to be concerned. How are babies and toddlers, we've heard about children being hospitalized. How are babies and toddlers and preschoolers doing in terms of disease if they become infected?
So the real challenge here, as we're thinking about the Delta variant, and I think that that's kind of what you're getting at, is that the Delta variant we know to be more transmissible than other variants that we've had. And that really does speak to why we have to be so cautious with our mitigation strategies. Mm-hmm. So we are seeing more cases among children because we are seeing more transmission among children, and because children are not able to be vaccinated and not in every setting, they're not being protected. Yeah. When we see more cases, we see more hospitalizations, more cases of severe disease. We have not yet seen an indication that Delta itself is more virulent in kids. What we're seeing is that there are more cases among them, which is, again, another reason to get vaccinated. We've also seen, interestingly, that in communities with high vaccination rates, they have fourfold lower risk of disease among kids than in communities with low vaccination rates. So we've seen the fact that cocooning works for them.
And that means the whole community has to cocoon our children. That is so important. Do it for the littles.
Exactly.
Do it for the littles. Exactly. And I'm sitting on the edge of my seat, almost literally, as many parents, and in my case, grandparents, are wondering when kids will be able to get that vaccine, that golden ticket, as far as I'm concerned. What is your best educated guess? And I will not hold you to this prediction.
Here's what I will say. I know parents and grandparents and kids are interested. And I mean, I've had so many kids say, I want the vaccine. I want. Oh my God,
my 8-year-old grandson is he's trying to sign up for a trial. He has been for months.
Right, exactly. The kids want it themselves. They want their lives back. So we are working with urgency, and we appreciate that urgency. urgency. And what that means to you is that when these vaccines are available for the kids, they will have had the maximum amount of due diligence around efficacy and safety to bring them to those children. Right now, we're looking at sometime in the middle of fall, hopefully by the end of the year, to be able to vaccinate these kids. And I know everybody is working with the urgency, and we want to do it with the proper science behind it.
Absolutely. Now, do you expect at some point that pregnant women as well will require a booster shot? This is the general population might?
We're actively looking at the science now. What I will say is that there are numerous vaccine series out there that were 2 doses and a boost. MMR, hepatitis B.
Yes.
This is the standard in vaccines. So we will absolutely be looking at the data, but I would not at all be surprised if that's going to be necessary.
Okay. And speaking of vaccinations, and of course, moms have to get their Tdap vaccine as well. Let's not forget about those other infections that we have to cocoon kids against. But in terms of flu season coming up, again, as you said, hard to distinguish between flu and COVID without testing. And so we have to be extra vigilant. Flu is also particularly risky for pregnant women, increased risk of pneumonia and hospitalization. So what's your best advice to pregnant women this flu season? Get it now, get it soon?
I mean, I would say, again, similar to the COVID vaccine, get it now, get it soon, get it as soon as it's available. If you happen to be going, you can get both at the same time. And, with regard to your other vaccines, if I can just put in a plug, this last year and a half, we're behind about 12 million childhood vaccinations. So get your flu vaccine, get your COVID vaccine, make sure your kids are up to date with all of their vaccines as well.
Yeah, that was scaring me early in the pandemic, but I guess it's continued just because parents were reluctant to take their children to the doctor for vaccines. Or anything. But it is so safe to go to your doctor. That's probably the safest place you can go. Far safer than Target or Walmart, really.
Or a play date or a slumber party.
Or a play date. Not that we can't have those things. But
we just need to do it safely.
Super important that kids don't fall behind in their vaccinations, because then we'll have other diseases, vaccine preventable diseases to worry about, and we don't want to worry about them.
Right. But to your point, flu vaccine, yes, please, everybody, they're going to be widely available in all the places you've received them before. And do not let the distraction, which is an important distraction of COVID, prevent you from getting what you really also need, and that is your flu vaccine.
And it's also another good reason to wear your mask.
Indeed. It turns out that a lot of these other things have diminished because of our mask wearing.
Exactly. It was an easy flu season last year for that reason, RSV, everything. So masking. Oh, speaking of which, nobody likes them. Pregnant women like them probably least of all because they're heating for 2, right? Remember that? Right? And you're taking more breaths and you feel like you can't breathe. Can you just reassure moms out there that wearing a mask when you're pregnant, if not the most comfortable thing on the planet, is safe to do, is smart to do, and adds, why that extra layer of protection or 4 layers of protection is so important?
It absolutely is. We have data, we have science now behind the risks of not wearing your mask. And there are really no data or science behind any risks of wearing it whatsoever. So I am with you. It is not comfortable. I am all happy to shed my mask when I go outside. Take those breaks that you need, go outside or leave a crowded area so you can feel more comfortable, because I know feeling comfortable at 9 months isn't commonplace.
Or 7 or 8.
But it is so critically important to wear your mask. And really the science behind it is great for protection and really no negative consequences.
Thank you for that. And I feel like if we all do this together, we can't do it alone, but we can do it together, right? If we all wear masks, if we all vaccinate, then we can put this behind us. And when we do, I asked this of Dr. Fauci a couple of weeks ago, really important topic for me. I got a thumbs up. But I'm going to ask you too. I asked Dr. Frieden when he was the director of the CDC. I feel like hugs are more hygienic than handshaking. And I'd be happy if handshaking just disappeared forever, but I don't feel the same way about hugs. I think they're healthier. They're more sanitary if you do it right, right? So tell me and reassure me, are hugs going to make a comeback soon?
I think we need hugs for our mental health. It'll be interesting to see what happens with our handshakes, whether we have handshakes and sanitizer. But I do think hugs are a big mental health thing. So I'm going to be hugging again.
And you're going to be on top of my list too.
Okay, sounds good.
Okay, deal.
Indeed.
Thank you so much. I can't wait to talk to you again. And I can't wait to put this all behind us, which we're going to do with your help.
Likewise. Thank you.
The help of everyone out there.
Indeed. Get vaccinated.
Yes.
And take good care of those babes, right?
Yeah, exactly. That's the plan.
Okay. Wonderful. Thank you.
Dr. Walensky. Thanks. Bye.